Welcome to Split Screen, a production of Love OV and presented by Harvey Goodman Realtors and ClickHarvey.com. If you're in the market to buy or sell a home, ClickHarvey.com is your one-stop shop to get it done quickly and easily. It is a seller's market. If you're thinking about selling your home or downsizing, upsizing, whatever the case might be, they can make it quick and easy and painless. That's right, I said painless. To sell your house right now. ClickHarvey.com has all the resources you need. And if you're in the market to buy, they have hundreds of photos of homes for sale in the Ohio Valley right now for you to check out at ClickHarvey.com. Big thanks to Harvey Goodman Realtors for jumping on board with us as a partner on the show. Our show today, a special Wednesday edition. We don't typically do shows on Wednesday, but we had a little bit of an issue getting on the air one day last week. So we're bringing our guest today. This is Theresa Palkovick from Valley Rehab Center. Hi, Theresa.
Hi, Nick. How are you?
I'm doing well. How are you today?
Great. Thank you.
Glad we could get you connected and get you on the air.
Yes, I'm glad we were able to do that. I know last time was a challenge.
Valley Rehab Center in Bel Air. Tell me about your business. What exactly do you guys do?
We're an outpatient physical therapy department clinic. We service patients with of all ages, from pediatric to geriatric patients. We have a lot of the most up-to-date modalities that we use in therapy. We have class 4 laser. That's good for arthritic patients, for people who have neck and back injuries, for people who have acute joint injuries. We do a lot of infrared light therapy. We do a lot of manual therapy. Manual therapy is a hands-on treatment where it involves deep tissue massage. It involves aligning the spine or the joints through mobilization or manipulation. Not quite chiropractic care, because there is a difference, a fine line between what PTs can do and chiropractors could do, but very similar. Do a lot of work with people who have dizziness or vestibular issues, balance issues. A lot of people live with dizziness or vertigo and don't realize that there's a lot that physical therapy can do to help with that. We also service sports injuries. The local high schools send a lot of their athletes here, so we have the facility to do that also. We're pretty well-rounded in the services that we provide. We do a lot of kinesio taping. You see athletes who have all this tape all over them. Well, we use a lot of those techniques also with all of our patients, because that's good for muscle re-education and facilitating a better movement pattern in patients. So we do a lot of different things here. We try to take a holistic approach to physical therapy. What I mean by that is we don't treat the patient's diagnosis, we treat the whole patient. So if you come in with a back injury, we're not just going to look at your back, we're going to look at your whole spine, we're going to look at your hips and your knees, your feet, because all of those things could be contributing to a problem in your back. So we try to look at people holistically and provide a more holistic approach.
On your last point there about treating the entire patient and not just the one section, somebody told me one time about like different pain, like neck pain and back pain. Sometimes it's doesn't even originate in that area. Sometimes it can be something that's somewhere else in the body that needs kind of worked out to repair that. Is that true?
Absolutely. One of the areas that we really see that is an issue is we see people who come in with shoulder pain, and they've seen their doctor, and their doctor tells them they have a rotator cuff injury, and maybe they haven't had their MRI yet or something like that. In some cases, people actually do have a rotator cuff injury, but in some cases, it's actually a neck problem, an impingement of the nerve in the neck. And because of that impingement, they have weakness in their rotator cuff, but it's because the nerve is being impinged, not because the rotator cuff is actually damaged. So when we evaluate a patient, we always treat the neck and the shoulder, or the shoulder girdle. So that absolutely is the case. When I talked about the manual therapy that we do here, trigger points in different muscles can refer pain to areas that you wouldn't expect. So pain in my knee could actually be coming from a trigger point in my back. And so if I just focus on the knee and I don't check out the back, I might miss an important component to that treatment.
Right. You're never going to figure that out.
Hmm.
You mentioned sports injuries. Do you see a lot of high school athletes or college athletes, young people that are dealing with heart injuries right now? I mean, obviously, right now there's not a whole lot of sports going on, but
Hmm.
going back, the last handful of years, I know sports injuries are something that is kind of a hot topic about, making sure high school kids are not getting hurt. But we still obviously be in contact sports. You still see a lot of injuries, knee injuries. Do you see that sort of thing?
Yes, we see a lot of knee injuries. We also see a lot of ankle injuries, and it's not just in your typical sports like, a football player.
Football,
We see a lot of shoulder injuries also, but we've even seen when you talk about sports, I know a lot of people have a broad definition of that, but we see
right?
a lot of band members who have knee and ankle issues. We see a lot of cheerleaders with
I was
those
going to
kinds
say
of
cheerleaders,
issues.
probably.
Right. And the other thing that we do here, because uh, I myself am trained in vestibular rehab, a lot of athletes who suffer concussions will suffer with dizziness, they'll suffer with double vision, they'll suffer with headaches, they'll suffer with balance or motor planning issues. And so we can also treat people for post concussion syndrome. So that's also an area for athletes that I think is sometimes missed. They tell them go home, rest, take a week off of your sports, and then go back. And then I know myself, my son had 3 concussions through high school playing football, and so he had some of those issues. So well, that was a reason why I got more into that, just so that I could address the issues that he was seeing. So that's another issue with a lot of athletes. Again, when we go back to treating the whole patient, sometimes a shoulder injury, what may appear to be a shoulder injury in an athlete may actually be a neck injury or a neck alignment issue. And the same thing with if it's a knee problem or a hip problem or a back or an ankle problem, it actually could be a back problem. That when they got hit, they got something out of alignment in their back, and that's what's referring the pain into the extremity.
You mentioned earlier at the beginning of the show being able to treat things like dizziness and vertigo. Knowing what very little I know about that sort of thing, how does one go about treating that with physical therapy?
Well, actually, vertigo, which is a benign paroxysmal positional vertigo or a BPPV, that is actually a condition of the inner ear where a lot of people say, well, the crystals got out of place in my ear. And that's a very true concept. In the inner ear, um, the mechanics of the inner ear are there's a sac that has fluid in it and has crystals that float around in the air and tell us how fast we're moving or what direction we're moving in. Attached to that sac are three canals that have hair follicles in there. That then the hair follicles, when we go forward or backwards, the fluid brushes against that hair and it tells us you're going forward, backwards, right, or left. Well, what actually happens, especially as we age, or when it's what I call BPPV season, when people are having a lot of sinus issues, a lot of congestion, and fluids backing up in their ear, what happens is those crystals move out of that sac and get into one of those canals. And so now, when that crystal's floating around in that canal, it's not supposed to be there. So when it hits that hair follicle, it's kind of like getting static in your radio, like all of a sudden, boing, whoa, I've got this vertigo or dizziness because my body doesn't know how to interpret that signal because it's not supposed to be there. So that's when people who have that kind of dizziness, it's not an ongoing dizziness. They'll usually report it when they go to lay down in bed at night or when they lay on a certain side or if they turn their head a certain way. But unfortunately, as we age, people over 65 years of age, about 50% of the dizziness that you see in people over that age is actually due to vertigo because of this problem. However, they go to their doctor, and most often they're told it's your medication, it's your blood pressure, So that's really a fallacy. In reality, only about 5% of the cases of vertigo that are like that are due to medication, blood pressure, or blood sugar. So a lot of people are walking around with vertigo or living with vertigo and changing their lives to adapt because they avoid those positions that trigger the vertigo, or they stay on meclizine or Antivert and they take that medication all the time. What they don't realize, though, is that actually suppresses their balance reactions, so it increases their fall risk. So now they're more likely to fall.
And that's no good.
Nope, that can lead to
You don't
hip
want that.
fractures or shoulder fractures or wrist fractures or a lot of other problems.
I'm learning a lot today. I didn't know any of that stuff happens inside our heads.
So as a physical therapist, we can actually do a test, determine which canal the crystal has fallen into, and we can take the head through a series of movements that then move that crystal out of the canal and back into the sac. And I've had people accuse me of being a voodoo doctor because they because they come in, they're sick, they're vomiting because they have vertigo, and we do the test and we do the maneuver on them, and they get up and they're like, wow, it's gone. Like, how did you do that? Did
It's
you do some
voodoo.
kind of voodoo on me? No, I am from New Orleans originally, but no,
Ah,
I'm not a
see,
voodoo
that's
queen.
it. It's voodoo.
So,
That's wild, though. I've never. So these crystals. I'm interested in these crystals. These crystals. They do these. You get the one crystal, like the crystal. That's it. That's all you get. Like they don't regrow.
well,
Like
that the science behind that is not totally clear. They're actually called otoconia, and they're not sure if we have a certain number of those, or if they do refurbish themselves over time, or if they dissolve. They don't really know that. That science is still out on that. But it does work. It absolutely does work. I mean, I can give you a whole list of patients that it's worked on.
that's
Um,
wild.
and
I've never heard of crystal. I
yep,
might as well be voodoo if you ask me.
I think that's where the term comes. He has rocks in his head. I've never heard
There you
that.
go. I've been told that a time or two. So, aside things like vertigo or sports injuries that we've talked about, a lot of people have just general pain. You got back pain, neck pain, knee pain, elbow pain, that sort of thing. What type of techniques are you using to clear those sorts of things up?
Well, one of the unique things that we do here is infrared light therapy. Infrared light is actually natural UV light that you see outside. There's a visible spectrum of infrared light and there's an invisible spectrum of infrared light. That light penetrates deeper than any other form of heat available in physical therapy. What I mean by that is people go to physical therapy, they get a hot pack put on them, or they get some ultrasound. Ultrasound penetrates maybe 2 centimeters. Infrared light can penetrate anywhere from 5 to 9 centimeters. If it's in the form of class 4 laser, which is like the infrared light on steroids, then it can go as deep as 9 centimeters. What infrared light does is it increases circulation to the tissue, which increases oxygen. So that's going to decrease pain. It also has an effect on the nitric oxide in your system, so that it actually causes an increased absorption of oxygen, so your tissues are going to be healthier. It works at a mitochondrial level or a cellular level, so it can help with some cellular degeneration or regeneration. So there's a lot of benefits to the infrared light. We also have an infrared light sauna here that we offer to our patients if they have a full body pain. Say people who have fibromyalgia or people who have multiple joint arthritis, they can get in our sauna. And it's a 20-minute treatment, and you sit in the infrared light sauna
I
and
love
receive a treatment.
I love listening to you talk. You just dropped like 25 words that I can't spell.
I'm sorry. I probably need to stop doing that
No, it's
because people
fascinating.
do
Like,
think,
no,
oh,
listen, I love listening to smart people talk because I have no idea what any of that. But so, like, you're talking about lasers. Like, I don't know anything about lasers other than they look cool at concerts. So this obviously is not a concert laser. This is a different type of laser. What do you do? Just like beam
we
it into my
do.
arm?
Yeah, we can do it in a couple of different ways. There are different heads that we use on the machine. So there's like a bulb head where you can actually say if I'm treating a neck or a back, I'd actually be going over the muscle tissue, and so then that light causes increased circulation or increased temperature in the tissue. If I'm doing, say, someone who has a peripheral neuropathy or they're very sensitive to touch or something, then we have a head that we can use that we can scan it. So you actually hold it maybe a half an inch to an inch away from the skin surface, and then you go up and down along the surface. So you can provide it in a lot of different ways. One of the things that we also use laser for that we've been very, very successful with is Bell's palsy. That's a facial nerve palsy where people get, usually from a virus, the facial nerve gets affected. It's right here in front of your ear, and it causes paralysis on one side of your face. And we have had some really good results. We have a series of pictures of the first patient we did when we got our laser that had Bell's palsy. She happens to work here. And in 10 treatments, we totally resolved. So over a
Wow.
2-week period of time, we totally resolved the paralysis. And most
Wow.
people who get Bell's palsy don't recover completely from that.
Right. Wow, that's amazing.
So the laser is a very good tool to use for treatment. It has a lot of benefits to it.
Okay. All right. So anybody that would like to get an appointment, how does somebody go about doing that? Do we need a prescription from a doctor, or not a prescription, but do we need a note from the doctor? How do we go about seeing you?
If the patient is covered by Medicare, they absolutely have to have a prescription from their doctor. In the state of Ohio, as physical therapists, we are able to provide physical therapy without a script from the doctor. However, most insurance companies still require that we have a script from the doctor. So what we suggest is that the patient can either talk to their insurance company and find out for themselves if they need a script before they call for an appointment, or if they say are in their doctor's office and they get a script from the doctor, they can call us. The doctor's office can call us, or the patient can call us, and we can get them scheduled. Whenever we schedule someone, we always do make a call to their insurance company before they come, so that when they come, for their first visit, they will know what their responsibility is going to be, what their insurance will cover, because we try to be very transparent with that. We don't want to provide any service that then patients aren't expecting that they,
Right.
might have a bill for. And we try to keep that as minimal as possible.
Gotcha. That's good. All right. The website is valleyrehabcenterbelair.com. You can visit there, get more information. Theresa, thanks so much for joining us. This has been fun.
Thank you. I appreciate it.
I think we all learned a lot here today on the show. And just Mikey's leaving a comment. Mikey says, just to clear things up, you don't do any voodoo.
No, I don't do any voodoo.
No voodoo.
No roosters with heads getting cut off. Nothing like that here, I promise.
All right. That's good to know.
All right.
All right, Theresa, thanks so much for joining us. We'll talk to you next time, okay?
Thank you.
All right, that is Split Screen presented by Harvey Goodman Realtors and ClickHarvey.com. If you're in the market to buy or sell a home, ClickHarvey.com is your one-stop resource to getting it done quickly and easily. That has been Split Screen. We'll be back with you again tomorrow. Love OV on Facebook.